Let me just give you a little context. A number of you were not here a month ago in terms of my background and where Brain Matters comes from. My specialty in psychology is an area called clinical health psychology. Health psychologists tend to be focused less on mental illness and more on physical health and all the psychological and behavioral factors that are related to our physical well-being. And the leading health problems in our country today and the leading causes of death are chronic illnesses. So diabetes, cardiovascular disease, brain disease, pulmonary disease, and so forth. And many of the factors that increase our risk for these illnesses are behavioral. And managing our behavior is a huge part of how we do with managing these factors. So that's a little bit about what health psychology is. And I mentioned last time that our economy has changed a lot as well over the past several decades. We've moved from being a manufacturing economy to a service and knowledge economy. And so the leading causes of disability in the workplace have changed as well. So, and as I mentioned last time, if you had a manufacturing job and you were struggling with depression, let's say, but your job involved something that was pretty routine with your hands, you could keep your job with a pretty significant degree of depression. But today, if your job requires interacting with people or managing information, depression then can become impairing pretty quickly. So depression has become, depending on person statistics, either the number 1 or number 2 cause of disability in the United States and other developed countries. But if we look at health promotion programs in most organizations, most of them are focused on diet, exercise, which is all well and good, and those things are important for mental health as well. But we really do very little in terms of promoting mental well-being. So the idea of Brain Matters actually came up to be a component in a wellness program here at Wright State. And the idea is, let's talk about some of the things we know about how our brains work and the things that contribute to good mental health as part of wellness. Okay. Why wait until somebody has a mental health problem to address these kinds of things? Let's go upstream. Okay. So that's where the idea of Brain Matters came from. Tonight we're going to focus on emotion, particularly negative emotion. Let's see what I need to do here. And my question for you, if your emotions were a car, who do you want in the driver's seat? Me. Yeah, and most people would say me. Okay. But that's not always the case. So the next question is, how do we put somebody else in the driver's seat of our emotional car? Okay. All right. Okay. Any thoughts about that? We let them. How do we let them? I'm sorry? Yeah, we'll let people get under our skin. Yeah, but we'll let them push our buttons, if you will, our emotional buttons. We hold grudges. We often will say things like, if only such and such would do so and so, then I would be happier. So I think most of us would want to be in the driver's seat of our own emotional cars, and so that's sort of my working focus here tonight. And we'll be talking later on in one of the other sessions about happiness. Tonight we're going to focus more on negative emotions. And I think about negative emotions in 3 broad categories. And one of the things we know about health is that when people experience a preponderance of negative emotions, that actually constitutes a pretty significant health risk. We often don't think about it, but depression, for example, is an independent risk factor for heart disease. Somebody who's depressed is at higher risk for diabetes, for example. Many of you have heard about the type A personality. That was considered a risk factor for heart disease some years ago. The component of the type A personality that continues to get some attention as a risk factor is hostility, kind of simmering anger and so forth. Okay? So not only does the experience of a preponderance of negative emotions affect our physical health, it obviously detracts from the quality of life. Now, having said that, these emotions are part of the human experience. And I would argue that they have purpose. Let me come back here. Physiologically, when we're sad or depressed, we tend to not feel much energy. In fact, it's kind of an energy-conserving state. And one way to broadly conceptualize when we experience this family of emotions, sadness, depression, and related emotions, is when we've perceived some loss. And that might be a real loss, the death of a loved one. Or in some cases, it's a loss of my self-regard or my self-esteem. Or it could be some other kind of loss. But broadly defined, this is one of the kinds of situations where we'll experience those emotions. Fear or anxiety we experience when we perceive that there's a threat. Well, let me back up. With the energy-conserving part of sadness and depression, it's sort of like allowing us to sort of hunker down and recover from this loss. With fear or anxiety, that happens when we perceive that there's some sort of threat. And what happens to us physiologically is our sympathetic nervous system gets activated. Heart rate goes up, blood pressure goes up, blood flow changes. Blood flow goes to large muscles. You've heard of fight or flight. That's what's happening in our bodies. And that actually is a pretty good thing if the threat is some wild animal that's trying to catch you and eat you. Okay? It's not so helpful if the threat is the letter in your mail from the IRS. Nonetheless, that's still how our body reacts to perceived threats. Okay? And some of us live with a good deal of fear and anxiety much of the time. So why are our bodies energized? Well, again, if there's a threat, our bodies are being prepared to deal with that threat. Okay? Historically, threats tend to be more physical. Now they tend to be more, they could be social or more cognitive, if you will. And then anger. Under what circumstances do we experience anger? Generally, it's when we perceive that something's not right or fair, that there's some kind of injustice. If we could step back even further from it, we can say that we perceive that there's a problem. And our bodies are energized when we're angry, much like they're energized when we experience fear or anxiety. If you want to fall asleep easily tonight, you probably wouldn't go find something to get angry about, because that's not very conducive to falling asleep, right? And in fact, some people who struggle with insomnia, some of it is because they've got this ongoing anger about something. So anger is an energizing emotion, and I would say we're energized to solve a problem. And we'll come back to that in a moment. So let me turn your attention in the packet to question number 1. We're going to focus quite a bit tonight on anger, and the reason for that is anger is the human emotion that tends to cause more human problems probably than any other negative emotion. People lose their jobs, people lose their relationships. Sometimes people lose their lives as a result of being angry and the way in which they behave when they're angry.
How does that influence war?
How does that influence war? Well, certainly on a larger scale. I think typically if there's war, a group of people are perceiving that something's not right or fair, and so they're engaging in some sort of action to try to assert their will. Now, personally, I think there's a lot more that goes into war than just anger. But certainly warring behavior, if you will, among individuals or groups can certainly be prompted by anger. And certainly anger can be a good thing. Anger has energized a lot of social change over the years. So even though I'm calling it a negative emotion, that's more with reference to the so-called positive emotions, the more feel-good kind of emotions, if you will. The fact that I'm calling them negative emotions doesn't mean they're bad. They have a purpose. So the question, when a person is angry, usually that means that some goals or goal haven't been met. And usually another person or another party is involved. And I've listed here, there are 4 ways that people behave when they're angry. This is actually sort of an obvious question, but what I want to do is look at, I've got a table here, so we're going to consider if a person has some goals that haven't been met and there are relationships involved, how do these different behavior patterns work? Okay. Now, I'm going to define aggression as any behavior that's intended to hurt or harm someone else. There are lots of things we do with language, I think, that are unfortunate. This is one term that I think gets used in different ways, and it's sort of unfortunate. We'll often use the term aggressive for somebody who's a go-getter, which has perhaps positive connotations. But for our purposes, I'm restricting my definition of aggression to behavior that's intended to hurt or harm. So somebody's going to hit somebody, the intent is to hurt them. If somebody calls somebody else names, the intent is to hurt that person. Right? So, if a person behaves aggressively, will they get their goals met? Yeah, I would say it's a plus-minus kind of thing. Okay? If I'm in the line at Meijer waiting to check out, and the person in front of me seems to have picked up every item without the barcode or without the price, and I'm getting all angry about it, if I'm strong enough, perhaps I could throw that person out of the way and say, here, check me out. Now, in the short term, my goals might have been met, but I probably have created another problem for myself, right? So perhaps with aggressive behavior, goals can be met. What's the impact on relationships? Yeah, by definition, if the intent is to hurt or harm, it's going to be a negative impact. So that's aggression. On the opposite end of the spectrum would be passivity, doing nothing. Saying nothing and doing nothing. Okay. If there's a problem, you have goals that aren't being met, and you say or do nothing, will your goals be met? By definition, no. What will it do to the relationship? Although I think that's, the comment was not make it any better, although I think that's one of the reasons sometimes people are passive. They think it's going to be good for the relationship to not express their concerns. So I would put that as a plus-minus. And my plus is small in both cases because I think long-term aggressive behavior is probably not going to be effective to meet your goals. And passivity over the long term is probably not going to be good for your relationships. So, let's combine these into passive aggression. And I would argue that this is probably the most common kind of behavior pattern we see from people when they're angry. So passive-aggressive behavior is behavior that's intended to hurt, but it's indirect. Classic example would be the silent treatment. Okay. My wife senses some change in my demeanor, and she says, "What's wrong?" "Nothing." "I can tell something's wrong." "What's wrong?" "Well, nothing's wrong." Okay. So she can tell from my behavior that there is something wrong, right? So there's a part of my behavior that's kind of keeping her in the dark, if you will. Okay. Or sometimes people will conveniently forget something if they're angry with the other party. Okay. "Yeah, I'll meet you at 7:45 tonight, but I'm angry at you. So I'm not going to worry too much about being on time. I'll just show up maybe I'll get there by 8. Okay, so this is passive-aggressive behavior. There's an intent to somehow hurt the other party, okay, but it's not direct, it's indirect. But in the passivity part of this is I'm not stating what's wrong. Okay? So with goals, my goals aren't going to get met. And if indeed I'm trying to hurt the other party, it's not going to help the relationship.
Isn't the goal to hurt them so you would have succeeded?
Well, with that goal perhaps, but when I'm saying goals here, I'm thinking that whatever the thing I'm angry about. Okay? Yeah, good clarification. Okay. So, assertiveness I would define as behavior where you directly indicate your concern, what the problem is, but in a manner that's not intended to hurt or harm the other person. Okay. So I had sent these slides to Beth. Suppose I showed up tonight and she hadn't done anything to load them or she hadn't made the printouts, and I'm not very happy about that. Okay. If I want to be assertive with her, then I just say, "Beth, I thought you were going to do this." So I'm not going to say, "You're an unreliable," on and on, which some people do, right? But that's aggressive behavior. I'm going to let her know I'm unhappy. If there's a problem and you can't get things done, next time try to let me know in advance so I can. Okay. So I'm letting her know what the problem is, but in a manner I'm not intending to hurt or harm. So will my goals get met? Maybe. There's no guarantee, right? What will it do to our relationship? Well, again, I would hope that it would be good for it, but sometimes we don't like assertive people. Point here is that when we are angry, behaving assertively of all the general behavior patterns, has the best chance of being a win-win in terms of our goals being met and it preserving or enhancing the relationship.
Can
So
this be
what
translated to a national level, countries treating each other?
can this be translated to a national level? Well, in my opinion, we need to start here with our own country first, and parties within our own country perhaps dealing with things assertively. But certainly, I think this certainly can apply to groups. So what's so difficult about assertiveness? If this is the only chance we have for win-win, why don't we just automatically behave assertively when we're upset? What's too hard about it? Ah, yeah. Can be.
It defies our sense of justice sometimes. If we feel that we've been wronged and we want to retaliate.
Yeah, I think that sometimes if we're upset and hurt, we want somebody else to. Mm-hmm. Plus, you say we haven't?
Right.
Yeah, I would agree. We haven't been, yeah. In fact, I was at a meeting at noon in our local school district where they ask for some community people to be involved looking at the guidance program at the school. And in a recent survey, they found about how concerned students are about drug use, alcohol use, depression, suicidality, students cutting themselves, these kinds of things. And so it led into some discussion about many young people don't have problem-solving skills. And I think one of the reasons for that is that, for example, many youth activities for children, when there's conflict, these days, who's solving the conflicts? Adults are. I'm old enough that when I was a kid, the only organized sport was Little League Baseball. So if I want to play basketball or football or anything else, it was on me to find others in the neighborhood who wanted to play. So we're playing. Did we ever get angry at each other? You bet. But we had to deal with it. It wasn't a matter of running to our parents. They would say, go fix your problem. So if we wanted to continue the game, we had to work it out. When my kids were younger and involved in youth sports, who had organized it? Adults. We had adult referees. So yes, I think assertiveness is not taught, and it's a pretty important behavior.
And who was on the sideline yelling and carrying on, modeling aggressive behavior?
Excellent point. Yeah, I can remember being at sporting events with my kids when police had to be called because parents had gotten into it. Yeah.
And who should be teaching the assertiveness? The teachers or the parents? I'm a teacher, by the way, and I resent the fact that it does go to the teachers, but it should be taught at home.
I would agree. I think this is primarily parents' responsibility. I do think, interestingly, I think there's a role for teachers. For example, how you handle conflict among students in your class. I would say that's an opportunity for you and for your students. So.
It should come from home. Because when it
Absolutely. And again, I promise I won't say when I was a kid too much here, but if there was a problem at school and a teacher had to punish me in some way, when my parents found out about it, they didn't say, well, I'm going to go talk to the teacher and find out what the problem was. Yeah, they probably add a punishment on top of it, right? Questions about this? Other comments?
Would assertiveness or the lack thereof be associated with participation trophies or anything like that when you talk about organizing sports and other things like that?
Yeah. If you're kind of alluding to when you say participation trophies that everybody wins, yeah. I sort of understand the intent of that, but I think confidence comes from success, if you will, from doing things successfully, and part of that development involves failure and losing. So if we raise kids who never lose, what happens when you're adult and you don't get the job you want? Yeah. Here in the medical school, fortunately it's not a large majority of students, but occasionally we'll encounter students that end up having a terrible time because no longer are they the top in their class. To get to medical school, they have been very successful and at things they've done. And so some get to medical school and drinking from the fire hose, which is often the way the curriculum's described, is overwhelming. And I think in some cases, those who have had to deal with difficulties and conflicts in their lives are better able to manage. So yeah, I think all this stuff can start at a young age.
What happens when assertiveness fails? What's your next backup?
Well, that might be a case where I'm just not going to win. If my goals may not get met. depending upon the situation, maybe I'm going to try being assertive in another way. I'm going to problem solve in another way. Because I don't think there's a guarantee that assertiveness is always going to work.
Does that then terminate then? And assuming that your goals aren't met, would that naturally then terminate in either passiveness or an aggression?
Not necessarily. I would hope that it wouldn't. Okay. So if my assertiveness, with my example with Beth, doesn't get resolved, then maybe my next step is to go to the department chair and say, we've got this problem, how can we work it out? So I don't think assertiveness, ideally in interpersonal relationships, is going to happen, with the party involved. But I think we can also, if that doesn't work, then we look for other channels.
Would it be considered passive aggressive if you had never said anything to her, just went straight to there?
Quite frankly, I would hope if I did that, my chair would say, what did she say when you talked to her? So that's what I would hope. Because I think, depending on the nature of the problem, I think going to the party involved makes a whole lot of sense first. In some respects, that might be a passive-aggressive thing on my part because I'm going to get her in trouble with the department chair rather than working this out between us. And working it out between us would be better for the relationship than if I go above her head.
You might have misinterpreted something.
Yeah, I might have, absolutely. For those of you that weren't here, one of the things we talked about last month was how negative emotions narrow attention, like looking through a straw. So if I'm angry, sort of by definition, I'm not seeing the whole picture. And one of the things I'm probably not seeing is her point of view.
What happens if we raise the bar and put it on a life or death situation?
Well, I think we all have a survival instinct. At that point, depending upon the circumstance, we may fight. And in some cases, there we probably get to war.
That's if you get someone else to do your work.
Well, and you're right. In many cases, that's the way it's done. In your packet is a page, at the top it says, I am worth it. This, I can't take credit for this. This comes from a book that actually was written back in 97. Redford Williams is a physician who spent his career at Duke studying the relationship between anger and heart disease. And he wrote a book years before that entitled Anger Kills. And then Virginia Williams, his wife, and he wrote this book called Life Skills. And this model of I am worth it is an approach to anger management that I think makes a whole lot of sense. And it's based on the notion that the purpose of anger essentially is to solve a problem. And anger only continues to have a purpose if we're going to engage in problem solving. So, in other words, we're energized when we're angry to solve a problem. If indeed no problem solving is going to take place, then the anger loses its purpose. So, I am worth it is an acronym for 4 questions we should ask ourselves when we're angry. So, the first question is the importance question. Is what I'm angry about important? So if I go home tonight and I see that my wife squeezed the toothpaste from the top of the tube instead of the bottom yet again, and I'm all upset about it because I've had a long day and I'm tired, if I stop and ask myself this question, how important is this really? Now I could, if I continue with my anger, I could say, well, you're actually going to end up getting more toothpaste out of this tube if we squeeze it consistently from the bottom. But again, how important is that really? My point is, we often get upset about things that really aren't all that important. Okay? And in this model, only if you get a yes question do you continue with your anger. If you get a no to any of these questions, then you need to let go of your anger, which I understand is easier said than done. Okay? But if it's not important, then my anger no longer has a purpose because it's really not in my best interest to say to her, again, please squeeze the toothpaste from the bottom of the tube. Okay. That's right. Now, anybody knows my wife, don't tell her I use this as an example tonight.
Pick your battles.
Yeah, it is. Absolutely. This is all about that. I think this is the hardest of the 4 questions to answer. Given the situation, are my feelings appropriate? Okay. Well, and often it's like, well, if I'm angry, of course that's the appropriate emotion. But sometimes the anger really has maybe more to do with loss. And the more appropriate emotions I ought to be dealing with are sadness or depression. Or maybe it's that I'm very anxious about something or afraid of something, and it's coming out as anger. So just the fact that I think I'm angry doesn't necessarily mean that's the most appropriate emotion to be having. Now, any of you that have been parents of teenagers, or parents of children in general, know that you can often quickly go from fear and anxiety to anger. You know, my son was supposed to be home at 11 o'clock, and now it's 11:30. Okay? Most parents are going to be experiencing quite a bit of anxiety at that point. Is he okay?
When do I get to go to bed?
When do I? That's part of it too. That's part of the anger part, you know. I'm losing my sleep. That's right. But then once I find out that he just lost track of the time, I know he's safe, then it's easy to shift over to anger. Okay. But the point is, make sure that this situation, if you can't identify what the problem is, where the injustice is, what's not right, then it may be that anger is not the appropriate emotion for this situation.
So in that situation, would it be better then to channel towards whatever the appropriate
Absolutely.
would be?
Absolutely.
There's already emotional momentum at that point.
Absolutely. But it may not be problem solving that I need to do, at least not in the kind of problem solving I'm thinking about with anger. So let's assume for a moment that I get a yes answer here. This is the control question. Given the circumstances, how modifiable is the situation? In other words, do I have control? Is there anything I can do to actually solve this problem? Let me use an example that probably nobody in here has experienced, but road rage. Okay. So I'm driving on 75. Maybe I'm going a little too fast like everybody else, but and then a car is blowing their horn behind me, flies by me, cuts in front of me, then slows down. I have to hit my brakes. Okay. Is that right or fair? No. So is this important? Well, we could die on the highway. Last year in the United States, over 30,000 people died in motor vehicle accidents.
Does it remain the case that 2/3 are involved with alcohol?
It's a high percentage. I'm not sure if it's 2/3, but yeah. So I would say it's important what's happening on the highway. Is being angry appropriate? I would say yes. This isn't right. Okay, we've got, for us to drive safely, we have to be courteous as well as obey the laws and so forth. Okay. Now, let's get to the control question. Is there anything I can do about it? Okay. Often people do things that are aggressive, do the same thing.
License plates and call up your local highway patrol.
Well, and that might be something a person would choose to do. What's the likelihood that that's actually going to result in anything? So I might say that's action I could take, and that will get us perhaps to the next question. But many people, if they choose not to do that, are going to, if you really ask this question, there's really nothing I can do about it. So I'm probably better off letting go of my anger. Well, again, easier said than done, but instead of speeding up and gesturing or whatever people are going to do, maybe it's time to shift to a classical music station and take some deep breaths. And I would argue that that's better for me. So let's say you're in a situation where there is something you can do about it. Let's say it's a legal matter. And you can take the person to court. Before you do, there's one more question to ask. Is taking action worth it? It might be in time, in cost. It could be, how is it going to affect relationships? So there are times where we might get 3 yes answers, but the worth it question we say no. Unfortunately, sometimes people, even if they say no there, continue to be angry. But if no problem solving is going to take place, then who's the anger hurting? Oneself. Questions about that?
I think the answer to the last question seems to depend on the answer to the third question.
Absolutely. Yes. If only if you get a yes to the third question would you even be asking the fourth question. Yeah. If there's nothing I can do, then there's no point in getting to, is it worth it? Mm-hmm.
Although if the situation isn't modifiable, if there's nothing to do, it still might be worth it to at least express your opinion.
And you know, and the point was, even if it's not modifiable, it might be worth expressing your opinion. I would say that's a form of taking action. You may not feel like it's going to make much difference, but excuse me, professional groups that I'm a part of, hopefully my voice is going to come back. Professional groups that I'm a part of will ask me to send a letter to a representative, senator, or representative about something. So I may not be very confident it's going to do much, but it's still got a chance, I suppose.
But it's strength in numbers. For instance, a gentleman that might take the license plate and call it in. Somebody else might be in an accident with that knucklehead that caused the accident, and it's on the record.
Right.
Well, this person had been speeding before. So there's
Or it's maybe it's somebody they're looking for, and you calling in helps them apprehend the person. So I would say this is actually the easier part than the letting go. So take a look at the bottom of the sheet. The first category of strategies to let go of anger have to do with reducing tension. Our bodies are equipped to act, so doing something physical can actually be a very good strategy. So, clean the house. Okay. Again, you're not going to fall asleep if you're angry at that moment, so do something active. Okay. That doesn't mean be aggressive. Related to that would be do something that's going to try to reduce the energy in your body. Okay? So relaxation, deep breathing. Unless you're well trained, if I say to you, I want everybody to slow their heart rate right now, most of you don't have that control over your heart. If I said to you, I want everybody to slow down their breathing, you can do that. So breathing is part of our physiologic behavior that we can take voluntary control over. And if indeed we slow our breathing down, our heart rate correspondingly is going to come down some. So the advice, take some deep breaths when you're angry, is really well-founded. The best asset we have when we're angry is our ability to think and reason. Back to last month. The angrier I am, the smaller the picture I'm seeing. Once I relax and calm down, I'm beginning to be able to see a bigger picture. Okay. If the job in front of me, back to the problem solving, if the job in front of me is to problem solve, the bigger the picture I can see, the more options potentially there are to me. I can also begin to see consequences of various actions. Okay. So actually the relaxation is a good thing even if problem solving is going to occur. But if I'm going to let go of the anger, that's real important as well. Distracting yourself. Did I put these on here? No. Any of you ever been in a heated argument and one of you said something that you both simultaneously found to be funny? And you both crack up? What happens to the intensity of your anger at that moment? It's gone. Now that doesn't mean you can't work back up to it. Okay. But at that moment, the anger has dissipated. Okay. So humor can be a great distractor. Now obviously you've got to be careful with that, because if I'm angry and somebody's trying to be funny and I'm not finding it funny, it's like to be, But, and it could be distracting yourself with something else. Sometimes people will say, let's say a couple will say, when we get angry, we say to each other, now's not the time to talk about it. Let's get away from this, go do something else, come back once we've settled down. Often a very good strategy. And perhaps in the meantime, distracting yourself. And then finally, using your brain to reason, reminding yourself of the no. Okay, I'm not engaging in problem solving here because I've decided it's not worth it. Or I'm not engaging in any problem solving because the toothpaste really isn't that important. So reminding myself of why I'm trying to let go of my anger.
And if it is that important, I can get my own toothpaste.
Absolutely. There's other ways to, exactly, which would be good problem solving. And the last bullet point here, remind yourself that letting go of your anger is good for your health. Selfishness is not always a bad thing. In other words, I may want to still be angry at that other party, but in staying angry, I'm only hurting myself. And in doing that, I'm putting that other person in the driver's seat of my emotional car. And if you think about it, if you're really angry at somebody, do you really want to give them that kind of control over you? But we often do that, don't we? All right, on the back of that sheet, these are some things to avoid when communicating anger. Kitchen sinking. You've heard the phrase, how's it go? Something like everything but the kitchen sink, yeah. What kitchen sinking is is I'm angry about this little thing that happened today. Let me pause right there. One of the things we know about our memories is that they tend to be sort of categorized, if you will, by emotion. So if I'm in a happy mood, it's sort of like being in the happy section of my memory library. And all those happy memories are more accessible. When I'm angry, it's like being in the angry section of the library. And all these other things that I remember being angry about are right at my fingertips. So what made me angry today is this thing. But and I'm also angry about this and that other thing that happened. Okay. Not very effective. Okay. Stay on task. So avoid kitchen sinking. Mind reading. Assuming we know what the other person's thinking, or assuming we know what's going on with the other person. I think this example comes from a book on emotional intelligence. Say you're on a bus or a train, and it stops. A man gets on with several young kids, and the man sits down, kind of puts his head down. Meanwhile, the kids are kind of making noise and bouncing around. And how are you feeling toward this man? Well, yeah, take control of your kids. What's wrong with you? Okay. Now, suppose you find out that they're just leaving the hospital where his wife and the kid's mother just died. How do your feelings toward him about not managing his kids at this moment change? So my point is, typically there's a lot more to the story. We often make a lot of inferences. So this is something good to avoid as well. Find out. In fact, a good strategy that I don't think gets used a whole lot is if you're kind of in an argument, if you can agree with the other party to switch positions, argue the other point of view, often that can be very disarming because it forces you to see it from the other perspective. And if you can't do it, then you probably haven't yet listened or understood the other person's point of view. Off-beaming, getting off track. It's kind of related to kitchen sinking. But stay on the problem at hand. Name calling. Great example of aggression. What happens when names start getting called? Or people? Yeah, it escalates. It certainly begins to get us off track. Character assassination. Okay. Yeah, typically not a lot of listening's going on at that point. Yeah. And if I had to circle one of these as, in my opinion, perhaps most important, it would be this one, absolutes. I use sports analogies. I'm a sports fan. If on a Saturday afternoon or evening in the fall, I'm watching Ohio State play football, and my wife, maybe not watching the game, but she comes up and asks me a question or tells me something, and then asks me again about it later. I say, what? And it's clear I don't remember anything about that conversation. She sort of has a choice at that point. She could say to me, you didn't hear what I said when I was talking to you during the game. Okay. And if she says that to me, you're right, I wasn't. Okay. Now then, if she says to me, You never listen to me. How am I going to respond? It's not true. It's not true. So I'm going to get defensive. Absolutes, especially in interpersonal communication, rarely are true. So as soon as somebody says always or never, the other party's probably then going to defend themselves because always or never isn't true. So it's a great way to get off task. So now the argument isn't about whether I listened while I was watching the football game. Now the argument is about whether or not I ever listen. And that's one where I'm going to dig into my heels because I know it's not true that I never listen. Okay.
If you countered that with, you always talk to me while I'm watching the game.
I have a better solution yet. When my wife says you never listen to me, I answer, you're right.
Side with her. That does stop it. And she's still your wife? Okay, that's right.
Almost 30 years, although I don't know why.
All right. Interestingly, this is really an aside, but one of the things I teach medical students and residents is an approach to patients known as motivational interviewing. And in motivational interviewing, one of the things that we avoid is debate or confrontation. And so an example might be, let's say I'm working with somebody. Let's say they've got some chronic health problems and the person's overweight and the conversation shifts to their weight and the person says to me, well, what do you really know about losing weight? Look at you, you're not fat. So at that point I could defend myself and say, well, that's true, but I'm not because I exercise regularly and I watch what I eat. Or I could say, no, I'm not fat, but I've worked with a lot of patients who are. But in doing that, I'm debating, right? So a way to avoid the debate is saying, if I were in your shoes, I would wonder the very same thing. Given that, how should we proceed here? So instead of debating, I've kind of disarmed it by put the ball back in their court. Anyway. And I think that actually that kind of approach, and part of what goes with it is a whole lot of listening. And interestingly, the other night was at an event where a physician's assistant student came up to me and said, I remember you coming to talk to us about motivational interviewing several months ago. And he was complimentary about the talk, which was nice to hear. But then he said, and I've been using it a lot with my kids, and it really works well. And you're absolutely right. So questions about some of the things to avoid with anger. Yeah, I see a couple hands. We'll go here, and then we'll come to that.
What do you mean by the example, you have to?
Sometimes you have to or must is sort of in the category of an absolute. And often I think to say to somebody, this is what you have to do, often is a product of narrowed thinking, especially if it occurs when somebody's angry. So once we calm down, then we might be able to see some alternatives to what I think might be the only solution. Does that make sense? And let me just add here, just a little off of what you just said, but sometimes arguments, especially when we get off track, end up being a whole lot more about how the problem's being handled than the problem itself. Sometimes an unimportant problem can result in a huge argument. So the argument started with, where are we going to eat tonight? And the way in which that never got resolved ends up in a lot of feelings of resentment. So it often is about the how. Okay. The hand in the back.
About your example with your wife with the absolutes, and I understand why the absolutes are a negative thing, but like in your example, if she had said to you, you didn't listen to me when I talking about that one specific example, but what if she's trying to tell you that this is something that's a pattern?
Yeah. Then, and I think that can be said in a way different than "you never listen to me." You know, if she said to me, you know, you weren't listening when you were watching the game, and I say, no, I wasn't, and she said, you know, it seems like this is happening a lot. That's still a different message than to say to me, you never listen. Now, I might at that point get defensive and think that she said you never listen, but if we, you know, rewind and see what she actually said, you know, that might be a reasonable thing for her to say. And hopefully that discussion, too, might be that maybe we need to figure out, be more respectful of each other when indeed we talk about something. Another comment? No. Okay. Let's see. I think in one of these sessions is on self-control. There are times of the day when we're probably well advised to not bring up important things because our self-control is going to be at a lower point, like the end of the day before people have had dinner. It's a prime time for conflict in families. We'll talk more about that another time. But so some of it's kind of recognizing circumstances too and communicating at appropriate times. So let's move on. Look at question number 2, which is on forgiveness. Sometimes we may not have the precision we need with it. Which of the following are involved? Letting go of bad feelings, removing consequences for the person with whom you are angry, forgetting what happened, and D, concluding what the other person did is okay. I would argue, indeed, forgiveness is all about letting go of bad feelings. So in that sense, it's intimately related to what we're talking about with regard to anger management. And we will come back to that in a moment. It doesn't mean that what the other party did is okay. One place where we use the term forgiveness, where we do remove, that's actually the next one of these next bullet points. So we're not saying when I'm letting go of my bad feelings that it's okay what happened. All I'm doing is saying I'm going to choose to no longer be angry about this. And it doesn't necessarily involve removing consequences. Those of you that are parents can think of times where your child did something that you were angry about. You invoke some consequence. Okay? As a teenager, maybe they were grounded for a week. Okay. Do you need to stay angry for that whole week while they're grounded? No. So you can let go of your feelings. The consequence is still in place. The place where forgiveness does involve removing consequences is when we use it with regard to a debt. You know, if a debt is forgiven, that means that you're saying the debt doesn't have to be repaid. But I would say in general, we need to remove this notion from the idea of forgiveness. And likely it doesn't involve forgetting. Let's go back to that emotional library. If you think about memories that you have from your life, what kinds of things are you most likely to remember? Things that had a lot of emotion associated with them, or things that had no emotion associated with them? Yeah. How many of you can remember with detail a lecture in a boring physics class?
I
Okay. If you had a lot of emotions about it, absolutely. But so-called flashbulb memories typically are of things that are highly emotional. I was in second grade when JFK was assassinated. And most people who were alive then, even children, can remember something about when they heard that news. Okay? Or the Challenger explosion, or 9/11. I mean, very emotional kinds of things. These are things that are part of the kind of the national memory, if you will. So my point is, the more emotional an event is, the more well ingrained it's going to be in our memory. So if there's something that I'm pretty angry about, there's a lot of emotion there. Chances I'm going to remember it. So, yes, although I'm going to remember it, I'm still going to try to dissociate the bad feelings from it. Because I think a lot of time people get hung up on, if I'm still remembering it, then I haven't forgiven. Well, I think those are separate challenges, and I think the forgetting, in some cases, is unrealistic. Makes sense? So, and I would argue forgiving doesn't necessarily mean that that's communicated to another party. There are times where the person that we need to forgive has died. And there are also times, I think, where to actually express forgiveness to that other party may turn out not to be a good thing to do. So, who's benefiting from the forgiving? Me. So again, I'm saying this is a selfish thing to do, and I'm using the term selfish in a good way. It's good for my health to not hold grudges. It's amazing to me sometimes how much we will hold grudges, and the party with whom we had the issue would have no clue that we're still angry about it. So who's being hurt here? Redford Williams, the physician who wrote Anger Kills, would be saying, by holding on to that grudge, you're increasing your risk of having a heart attack. Questions about this?
How do you forgive the practical joker?
How do you forgive the practical joker?
That sounds like aggression.
Well, the intention of somebody's behavior and how it's received aren't always on the same page, right? So, and practical jokes actually is a good example of that, where if I'm the one playing the joke, I'm maybe well-intentioned. I don't mean any harm, but the person experiencing it may find it very harmful. Yes?
Letting go of that feeling can be easier said than done.
Absolutely. I don't think it's like a light switch. It takes work and practice. It takes kind of reminding ourselves. And some of what I think is important to remind ourselves of is why we're doing it. Or, in some cases, sort of the fallacy of why we're hanging on to the anger. Sometimes it's sort of like I keep feeling if I stay angry at the person, somehow I've got some control over them, which in many cases is not the case. And often is unnecessary. Like if I grounded my kid, what am I accomplishing by staying angry for the whole time that my kid's grounded? Really, nothing. Yes?
If my wife is angry at me and she's giving me the silent treatment, and I know that she's angry with me about something, and I'm buying her flowers, I'm cleaning around the house, or I'm doing extra stuff, and all she's doing is being silent, does that help? You see what I'm saying?
Does what help? You doing?
Me trying, but not knowing.
If I'm in a situation like that too, and if I know there's some kind of problem in the relationship, and I'm trying to make amends, I I think that's okay, but ultimately we probably really need to find out what the problem is and address it. Unless it's unimportant. You know, if it's really unimportant, sometimes I think in relationships, you know, the notion that anytime I'm upset, I've got to communicate it. Well, I don't think it'd be good for my marriage if every time I brush my teeth, I bring up the toothpaste.
But you know, for him, by the way, we like when you do all that.
Yeah, keep doing it. That's right.
Yeah, keep it up.
Plus, you know, kind of the nature of relationships is that we're in any relationship that we're different people. We're not always going to be on the same page, and I think sometimes this is probably selfishness in a negative way, that we think the world ought to revolve around us. Make an appointment. We'll talk about it.
Was that passive aggression I heard?
It was an invitation to resolve it. That's right. That's great. How are we doing on time? Just a couple other things I'll mention briefly, and then we'll be done for tonight. In terms of treatment, the approach I use is what would be called cognitive behavioral therapy. I think that came up last time. And in cognitive therapy, it's about looking at our thoughts and finding ways to change our thoughts. Just a bit about an example of it here is, I'm not sure if there's a pointer on here, but when we find ourselves experiencing something emotional, so the third bullet point here, I'm upset, I'm irritated. It can be useful to stop and say, okay, what triggered this? Back to the A. What was the adversity? Okay. What upset me? Okay. And one of the things we often make assumptions about is we think that A causes C. Okay? That this thing happened and I'm mad about it. What we often fail to appreciate, now let me pause here. In some cases, things do happen very quickly. We react almost instantaneously. Okay. But in most cases, there's a B in there. And the B is for belief. Here would be a synonym for thoughts. What is it that I'm thinking about A that leads me to feel whatever emotion I'm feeling? Because typically there's more than one way to think about things. Okay. So let's say somebody comes to my office and, oh, I'm so depressed. Well, what happened? I failed a test. Okay. So failing a test has made you all depressed. Okay. So I'm going to want to find out more about that. What is it that person's thinking about failing a test that's leading them to be depressed? Okay. If their thoughts are, I failed this test, I'm never going to be able to pass this course, and when I don't pass this course, I'm going to flunk out of college, and I'll never be able to get a job, and I'm going to end up homeless. Okay. Maybe that's something to be depressed about. But let's look at that thinking. Okay, you failed a test. What's another way to look at failing a test? Okay, not the end of the world. How did you study for this test and whatever? So the D I've got in all caps here. This is really a valuable skill, to be able to dispute one's own thoughts, one's own beliefs. So when we find ourselves experiencing some significant negative emotion, especially if we're not sure, let's go back and look at what triggered it. What is it I'm thinking about the thing that triggered it? And then the disputing is, what's another way to look at it? And then if we look at things in a different way, often we're going to feel differently. Now, it's not like this is a magic cure, but the idea of this is that we often just don't examine our thoughts. We sort of assume that what I'm thinking is the way it is. But we can change our thoughts. We can take other perspectives. My example of the guy on the bus. You learn some information, can change perspective drastically. And then the last thing we'll talk about. This is actually something from optimism and pessimism, which has been found to be very related to health as well. Optimistic people, on average, have better health and actually live longer. In some studies, we're talking years longer. Now, we typically think about optimism and pessimism as part of personality, and indeed, that's a reasonable way to look at it. And when optimism and personality are studied as personality traits, we find those same results. But what I'm going to talk about here is optimism and pessimism as a learned behavior. And it's how we think about negative outcomes. Okay? And typically we make attributions or do this explanation on 3 dimensions. One is, did this bad thing happen because of me or not me? Secondly, are there reasons for this bad thing happening due to things that will always be present, or are they more temporary? And then lastly, are the reasons for this bad thing happening factors that are specific to this situation, or do they affect lots of things in my life? I've got an example here that hopefully will, you can't read that very well at the top, but it says, my checking account is overdrawn. A lot of people don't balance their checking account, but you've overdrawn your account. Okay? So this bad thing. Now, why did it happen? Okay, let's just look at some possible explanations. So if we look at an internal explanation that's stable and global, I can't do anything right. If we look at an internal attribution that's temporary and specific, the one time I didn't write down a check is the one time my account got overdrawn. Okay. Which explanation is better for that person's health and mental health? Obviously the second one. We can look at the external dimension. All institutions chronically make mistakes.
Not my fault.
Yeah, it's not my fault. That's right. But maybe it's the bank's fault. I'm surprised my bank has never made an error before. Okay. So now again, in some cases we know the reason, but many types of adversity in life we really don't know exactly what the reason was, or there are lots of possibilities, lots of contributors. The idea here is how we explain bad things profoundly affects our thoughts about the future. If I'm incapable of doing anything right, why try? If I forgot one time to write down an expense, okay. All I need to do is next time write it down. Research in this area has been done in lots of realms. People in certain kinds of sales, for example, life insurance sales, what's the most common answer to from a prospective customer?
I can't afford it.
No. If you can't deal with no, you're not going to last very long in life insurance sales. Okay. And indeed, when measured on these dimensions, the ones that stayed in the field and did well were able to explain no. It turns out it's less important whether it's internal or external, but to unstable and specific, temporary and specific reasons. Any of you remember who Matt Biondi was?
Number one salesperson.
No, not sales. He was an Olympic swimmer. And he was projected to win all of his events. And he didn't win gold in his first event. I forget what Olympics this was. And lots of people were saying, wow, everybody said he would win all of these gold medals. He didn't win. My gosh, if I was him, I'd probably be hard to get up for any more races. Okay. Turned out he was a member of the Stanford swim team, and actually some of this research had been done with these swimmers. And it turned out Matt Biondi was among the most optimistic of the swimmers on that team. An optimist, after a failure, typically will do better. A pessimist on this dimension, after a failure, often will do worse. Okay. Biondi won the rest of his races. And actually, sports is a good place to see this kind of thing. Sports writers after an event want to interview, pitcher gave up a home run and they lost the game. Stick the microphone in the pitcher's face. What happened out there? Okay. Actually, that pitcher is going to give some attributions. When this has been studied retrospectively, looking back at old newspaper articles and whatever, those who had more pessimistic attributions tended to die sooner than those who had more optimistic attributions.
How much is optimism genetic?
If you look at it as a personality trait, I would say probably in the 50% range.
So it's a toss-up.
The person who has done most of this research, Martin Seligman, would himself say he's sort of a pessimist by nature. In fact, one of the books is called Learned Optimism. So these are some examples of ways that with just how we think can be an important part of managing negative emotions. When something doesn't go our way, when there's adversity, it's natural as human beings to experience some negative emotions. Something like this, being able to dispute negative thoughts, are important components of resilience.
Would it be a good idea to be around optimists to learn?
Absolutely. I think those kind of things can be contagious. You've heard the phrase, misery loves company. When that's been studied, it's actually not quite true. Misery loves miserable company. Okay. And in fact, emotion is contagious. Okay. I'm sure you've all been in situations where, a really sour, irritable kind of person just, kind of takes the air out of the room or whatever. So negative emotions certainly are contagious, but positive emotions certainly can be contagious as well. And again, the message here tonight isn't that we shouldn't have negative emotions. That's part of life. But it's a matter of staying in the driver's seat of our emotional car to manage them in a way that works better for us, better for the relationships in our lives, and better for our health. So with that, I'm going to stop. I'll stick around a bit for any of you that have questions that you want to ask personally. Thank you for putting up with a crowded room, and thank you for being here tonight.